How does primary healthcare nurses' own health and wellbeing impact on their ability to provide health promotion messages to their patients? Data from a recent Australian nurse survey resulted in over 6,000 responses, which demonstrated that many Australian nurses are reluctant to provide lifestyle education to patients if they perceive themselves to also be unhealthy. This raises questions about how we as nurses look after ourselves, how our health impacts on our work, and the image this portrays to each other and the community. Please welcome Kay Ross from Southern Cross University.
Okay, so thank you for the introduction and welcome everybody. We've got a room full, so that's exciting. Now, what I've done, as the introduction said, is I surveyed Australian nurses. And I don't know if any of you responded to the survey. I hope you did. I've got some nods, so thank you. So I had over 6,000 responses to a survey asking Australian nurses about how healthy they were. And I looked at 6,000 responses and I got really excited. But for me, it also said I'd hit a nerve. That nurses, I had a lot of nurses making comments like, I've been a nurse for 30 years and this is the first time anybody's ever asked me about my health. Or another one said, thank God somebody's doing this, we need to look at our own health. And from that, there's a whole lot of information that I'm looking at. And so today I've just picked just a tiny little piece of it. As you can imagine, the data from 6,000 nurses, I'm still wading through it. So today I thought I'd talk a little bit about nurses as role models. And let's see if I've got this going the right way. I have. Okay, I'd like to thank the former Department of Health and Ageing. I was lucky enough to get a grant to do the survey, and from the Chronic Disease Prevention and Service Improvement Flexible Fund, a big mouthful, but I love them. And I was a lead investigator on this survey with help from Dr. Jennifer Barr at Southern Cross University. So I'd like us to think about how important is image. Now, so far today, Dr. Rosemary Bryant this morning talked about the importance of us as nurses providing health promotion and health education messages to our patients. And then we've just had Liz talking about in those standards she looked at from those countries that health promotion and health education came up. Do you remember seeing that and hearing that? So, and I look at you guys in general practice and in primary health, and you are at the forefront of those health promotion messages. I also looked at the news. Even yesterday, there's a new survey, a new research coming out, and it's not one we want to know about. It is saying that Australia is fast becoming one of the most obese countries in the world. We're doing a really good job at becoming obese. So something has gone wrong. Would you agree with that? We have had how many messages from Norm? Those of you who are in my age group, can you remember the Life Be In It messages? And we had to try and get Norm off the couch. And since then, we've had numerous messages from the Measure Up, the 2 and 5, etc., all telling us what to do. And I think when I go out onto the street, if I ask somebody, is it important to be healthy? They'll say, yes. And then if I ask them, are you healthy yourselves? A lot of people will say no. One of the scariest things from the survey was that over 30% of nurses at this very moment in time are at high risk of developing type 2 diabetes. Most of you know about the OSD risk, and the high risk is within the next 2 years. 35% of nurses are at high risk of developing type 2 diabetes. That is scary. So let's think about it. How important is image? Us as nurses, how important is it for us as a nurse, especially working primary health, to portray a healthy image? I think it's a question we have to ask ourselves. That's a real picture, a nurse having a cigarette. Okay, now I started my nursing back in the old days, okay? And back in the old days, there was about 65 people in my nursing group and about half smoked. Do you remember those days? And I trained at the old kids' hospital, which was really good because at least the kids didn't smoke in bed. But I had to go down to an adult hospital for my 6-month adult training, and one of the things I remember as a junior nurse, my job was to run round to empty the ashtrays and to empty the sputum mugs in the respiratory ward. And I've got some nods. Thank heavens things have changed. The survey shows that at the moment about 9% of nurses smoke, which is still way too much, but the good news is it is just slightly under the national average, which is about 11% for adults. So we still have nurses smoking. If a nurse smokes, is that nurse the best person to be telling a patient they shouldn't smoke? I don't know. That is the question, and I'll give you some answers to that in a moment. Okay, that's a nurse. Should this nurse be up there telling patients to lose weight, to stop drinking and to stop smoking? Is this the image that we do or should portray? Okay, that's typical Australian adults, unfortunately, at the moment. Now, research shows that nurses perceived that society expected them to be role models and to practice what they preach. So this is some research from 2005. Also, another one from 2011, ensuring that Australian nurses take responsibility for their own health and act as role models for healthy lifestyle messages is imperative for the successful delivery of government policy. They've actually said that we as nurses should be healthy. Hasn't happened, but they're saying we should be. Part of the underlying problem with nursing's lack of effectiveness in promoting healthy lifestyles may reside in the failure to personally value such lifestyle behaviours. So some research is saying that part of the problem might be that nurses actually don't see it as important. That's scary. A couple of years ago, when I worked in South Australia, I was in charge of setting up a training program for health workers to work one-on-one with people for management of the lifestyle risk factors, so the SNAPs, smoking, nutrition, alcohol, physical activity, stress, and then we put obesity on the end, so you've all heard of the SNAP. So one of the things that I noticed, and I had people telling me time and time again, we had these 33 health workers, including about half of them were nurses, coming to me and saying things like, you know, I really need to do this myself. And I'd be saying, yes, you do. We all do. So I guess the challenge is we actually have to start thinking about what message are we portraying to the public. Now, this is interesting. When we think about what nurses are, we have these pictures of, you know, providing care to our patients, and I did find some male role models there, providing health promotion, education, etc. However, I did a Google image of the word nurse, and this is scary because it is telling us, now if you look at all those pictures, they're all happy. They're all mostly female, which is a bit scary. They're all young, okay? This is what you will get if you do a search Google images for the word nurse. This is what the community thinks about when they think about a nurse. Unfortunately, we've got some slightly pornographic ones in there as well. And I'm not sure, is Nurse Betty? She was in there at one stage. Yeah, Nurse Betty over in the corner, for those of you who've watched that awful show. Okay, I'm not sure we want her as a role model either. But it's just an example of what society thinks of nurses or portrays nurses as. Now, there's some that are okay. We've got this lovely nurse here, those of you can see it, providing care to an aged person, etc. But she is young, healthy, and probably pretty. So, The survey. 80% of the nurses who responded to the survey, and I asked a question, should nurses be role models for patients in terms of lifestyle risk factors, 80% of nurses said yes. More than 60% felt that nurses who are unhealthy role models negatively impact on their ability to provide health promotion messages to their patients. So 60% of respondents said if a nurse themselves is unhealthy, then they are going to negatively impact any lifestyle message that they give to their patients. That's a big statement. In the UK, they've actually now got a statement that says that we have to get our nurses healthy. They have actually said that nurses have to be role models in terms of lifestyle risk factors, and they're providing programs and support for nurses to quit smoking, increase physical activity, etc. Now, I also had some statements, and most respondents disagreed with the statement that said an overweight nurse is ideally the best person to talk to patients about the benefits of losing weight, eating a healthy diet, and or engaging in physical activity. So most people said that if a nurse themselves is unhealthy, they shouldn't be providing that message to their patients. They also said that nurses who smoke are ideally the best person to talk to patients about the benefits and process of quitting. They disagreed with that statement. So they are saying that if a nurse smokes, that nurse should not be providing anti-smoking messages to their patients. Now, for you and I, that probably makes complete sense. However, in the workforce, because a lot of us aren't as healthy as we would like to be, we are in, I'm being told to hurry up and shut up. 5 minutes, okay. We're being told that that is part of our job. And in primary health, in general practice, it is very much a part of your job. So the challenge has to be, what can we as nurses do about our own health? Talking about role model, whether you're, I don't care what side of the fence you sit on, everybody heard about the fact that Joe Hockey had a cigar. Would you all agree, you all those in Australia? And it hit the news, and it hit the headlines, and it was on the radio, and it was on a current affair, etc. So here's just two opinions. Treasurer Joe Hockey's image goes up in smoke, and that cigar puffing image will go straight to the pool room. Joe Hockey's cigar smoking criticised by health expert. Now, there is no surprise in that. Here we have got somebody who, for one reason or another, is up there in the media, and we actually hold those people, we have high expectations. To find that this person was human and actually smoked. Now, I don't agree smoking by any way. However, I'm not sure whether that's the right way to go. Do we? Well, we do. We already hold people to high esteem who are in the public eye. And you hear about if somebody takes drugs or is in jail for a DUI or whatever, we hear about it. Can fat nurses be good nurses? This was from the UK, and it actually starts off with, if the role of a nurse is to teach patients and the public about healthy lifestyles, is it possible for an overweight or obese nurse to be an effective nurse? That's a good question. You can, when these are all loaded on the website, you'll get the link to that. On the other side, the irony of the nurse who smokes. It's crazy, huh? Nurses are at the front line of tobacco treatment and prevention, yet they're the most likely of all healthcare providers to light up. Why is that? Now, in my survey, I can tell you, there's one word that nurses used over and over and over again. Anybody like to stress? It is not surprising. Stress was the number one thing that nurses either brought up or agreed to. And stress was impacted by workloads, shift work, the bed closures, the more and more work to do with less and less resources, etc. So stress, and those nurses who smoked, the stress was up there like that. Stressed nurses are forced to choose between health of the patients and of their own, and it starts with nurses are enduring unprecedented levels of stress and ill health as a result of staff cuts and overwork, forcing them to choose between their patients' well-being and their own. Anybody surprised by that? No. Over there, stress on nurses putting patients at risk, warns the RCN. This is from the UK. And again, it starts off with patient care is being jeopardised by the pressure put on nurses, a new report suggests. It's not rocket science. It's what we've now got as a result of the survey. We actually have the evidence. Before that, we didn't have the evidence. So what's next? Okay, I had a lot of nurses say, well, okay, you've got all that data. Some of you it's been in the newspapers, it's been on TV, been on radio, so a lot of people have been talking about the survey, and they're all asking what's next. It's interesting that there is an overwhelming silence from all the departments of health. And yet nurses are the biggest, and you've already heard this today, there's over 320,000 nurses and enrolled nurses in Australia. We're the largest workforce, and we're in strife because we are unhealthy. About 30% of nurses already have a diagnosed chronic disease, and of those 30%, at least half of them had to take time off work in the last 12 months. It's going to get worse because I don't know if you noticed, but we're also ageing. And about 40% of nurses are over the age of 50. And in the survey, about 40% of nurses said that they would be looking at retiring between the next 10 to 15 years. Now, this was before the last budget. It might be we have to stay, and so we'll be in our wheelchairs with our walkers running around doing our rounds. So some of the things that have come up to think about is we need more research, absolutely. We need more research to now start looking at what are the solutions. And I can tell you that health promotion by itself is not working, as evidenced by our growing obesity epidemic and as evidenced by the fact that we as nurses aren't as healthy as we should be. Nurses know this stuff. We now need to take that knowledge and actually put it into action. Wellness centres. What a concept. In the US, there are now some hospitals that have what they call a wellness centre for nurses, where nurses can go and maybe have some healthy food. Now, I know that's almost an oxymoron in hospitals and in clinics. Healthy food, who would think it? But apparently some places are starting to do it. They can also actually just sit down, relax and not have the call bell or their phone ringing or whatever. Online wellness coaching, which is something I'm looking at the moment, because as nurses, whether we work in primary health care or not, I don't know if you do, but I actually have a life outside of work. I don't know if anybody else does. And so it can actually be a challenge sometimes to do some of these things. Healthy food options at work, anything else. We're going to generate some of that. I've started up a Facebook page, almost got the website ready to go, called the Nurse Wellness Project. So if you go to facebook.com and /Nurse Wellness Project, I'm starting to put up some of the results from the survey and we're starting to generate some discussion around this. This is just the beginning. I've just given you a tiny little snapshot of the research, and thank you for your attention. Thank you. Yes.
Thanks so much. Has anyone got any questions? I'm feeling a little bit nervous because I'm remembering that I was probably one of those nurses that used to duck out have a ciggy, and the patients will be lined up just down down a little bit further. So yes. Anyway, so any questions for Kay?
Oh, yep.
Was that chocolate that you got?
I've got no idea. Any other questions? Yeah. Yeah. Thank you.
One statistic we did quote in that was the national average actual smoking average.
Yeah, it's around 11 to 12%.
So it's come down significantly.
It's come down significantly. anybody know why smoking came down so much? Price and policy, health policy. In the old days, we had patients smoking in hospitals, you'd get on a plane, public transport, restaurants, etc. The one thing that has brought down our smoking is policy. So I'm not sure, I think we now need to look at some, and people have started generating some policy stuff around some of these other health issues. So yes, smoking has come down, but it's not just because of health promotion, even though there has been some really good health promotion strategies to quit smoking. Yeah.
Do you know if there are any useful to reduce some of the policies around
Who knows what's happening with this government? I think the easy answer is no, they're not putting money into anything. Yeah. Yes.
I was going to say, so the image of nursing is still, we've still got a way to go.
Yeah.
With our issues.
Yes.
You know, we're still not considered as professional as what we should be.
Yeah.
And it's quite frustrating.
And what was scary for me was, I was at another conference last week speaking, and there was I won't say the name of the company, but they had this huge poster with 4 very pretty young nurses at the front, and they were all female. At the back was a male, who I think was a doctor, and it actually said, behind every doctor is a team of good nurses. And I shuddered. I thought, here we are back in the old days where nurses are running around doing what the doctor tells them instead of us being an autonomous being. And I think, as you said, those pictures are still from the 60s and 70s, which is scary. We're slowly changing, but unfortunately, I think the TV shows you can all think of do not put nurses in a good light. So I could keep on talking for another couple of hours, but they've told me to shut up. I'm around for the next couple of days. You've also got my email, but it's basically kay.ross, R-O-S-S, @scu.edu.au, or look for Nurse Wellness Project on Facebook and you'll find me there. So thank you.